What's going on, y'all? Tyrell Friday here with FutureDDS.
Tyler Brown here with FutureDDS.
And today, we're going to let you guys in a little bit on how our job search is going. Let's go.
So if this is your first time visiting our channel, what Tyrell and I do is we give advice to pre-dents on how to get into dental school, as well as show pre-dents and everybody else how it's like being a dental school student. So if you haven't already, make sure you hit that notification bell, the subscribe button. Might as well go ahead and give the video a like early. We're sure you're gonna like it, maybe not, but no, I'm playing. You're gonna like it. And yeah, enjoy the video.
All right, y'all. So as you guys know, Tyler and myself, we are actually on the way out the door, so to speak, of dental school. Up the ransom. Go up the ransom.
Boy, if you don't... Oh, you dancing now. No.
Back. So we are going to take you guys through, give you guys a little insight into our mind, our thought process as we go through these contracts, as well as different opportunities that we may have seen and some different pitfalls that we have been told to look out for. So let's get into it.
First and foremost, I think all of us were a little bit nervous about what the job market was going to look like because of COVID, and we are here to tell you that there are still jobs out there.
There's a lot of jobs out there.
There's a lot of jobs out there. Now, it might kind of vary where you're looking. For example, I've been looking at Houston and Atlanta. Houston, not so much. I mean, I've been looking for jobs, haven't got that many hits, but as far as Atlanta, a lot of hits. I don't know why, but it's weird. I don't know.
I think the Atlanta play might be so open now because Atlanta and Georgia as a whole is starting to take the ADEX and the CDCA exam, and they're getting away from taking the credits exam, which they've traditionally done, and it's kind of, you know, brought them to having a shortage. So granted, if you want to go to Atlanta, look, make sure you apply, make sure you take CDCA, live patient portion, all of that good stuff.
You come work for me in a couple of years.
No, but further though. So, all right, but you know, on my end, I've been looking at different opportunities in Georgia, of course, as well as, you know, thought about Houston a bit, but I think I'm going to end up settling in Maryland. That's what it's looking like. That's where the most hits have been. And again, out there are also a lot of opportunities, a lot of different opportunities in both places. And we're going to take you guys a little bit into those details. So in Atlanta and Georgia as a whole, again, it seems to be a shortage. So there are a lot of opportunities in the city, outside of the city, in the country, wherever you want to be kind of in Georgia. If you want to get to Georgia, I'm sure you'll be able to find a job in the next couple of years because of how the floodgates are kind of opening with them now accepting the ADEX and the CDCA. So Tyler, of course, that being his number one choice, he's in a very advantageous position. So, you know, I guess if you could, you know, just let us know a little bit about how that process is going and where you thinking about looking, or, you know, if it's in the city, outside of the city, and maybe price differences and things like that.
So it's interesting, right? Because you have to keep a couple of things in mind. So first and foremost, I'm from like North Atlanta, and you know, eventually I do want to open my own practice, do these things, and so the way I look at it, say I get a job and I don't necessarily want to buy the practice from that owner, or say I don't want to necessarily be in Atlanta, you know, right now, just because that non-compete is a real thing. So say if office is like right in the heart of Atlanta and they say I can't practice within a 15-mile radius, it's just kind of like
all of Atlanta.
It's like, wow, okay, I'm kind of
you stuck
out of luck, you know what I mean? So I'm more so looking for things on the outskirts of Atlanta, and I mean, especially as a new grad, financially, I think that outside of the city, there's a greater opportunity as a new grad to make a little bit more money. And so that's what I've been doing, and that's kind of how I've been approaching everything. So.
Got you. So see, there's a little bit different, I guess, landscape when you look at jobs in Maryland. There aren't as many DSO opportunities in Maryland, or if there are, they aren't necessarily as equally spread in the city, major cities, and these more heavily populated areas where most people may want to live. And then, you know, they're more out on the outskirts or in these little pockets where there's like a higher need. So, you know, with that being said, anyone who's out there looking for a job, if you're going to the outskirts, if you're going to, you know, a more rural area, your signing bonus is going to be higher. You know, you can kind of negotiate a little bit more about your average salaries and different things of that nature. So that's one caveat that you may not have. On the other end, because certain situations are so saturated, you do have a lot of different situations where you can find private practice owners. You can find, jobs, offices that are already established that just may need another associate there in a private practice setting. And you get a different type of experience or a different feel than we're traditionally used to seeing, in a DSO or that type of model where it's typically a little bit higher volume. So it's a little bit more fee for service in these areas where you might get private practices and they're to charge a higher premium and they have different specialists coming in versus a DSO where they may be doing more high volume and they are able to charge a lower premium because they are getting so much volume and so many people in and out. So in my mind, I've always had the idea of going to a private practice. Obviously, I'm still entertaining and speaking with the DSOs or the dental service support organizations like the Aspens, the Heartlands, the PDS, or Pacific Dental. And just kind of making sure I'm not leaving any opportunities on the table, but my heart has been set on going private practice since I started dental school. So that's really where I've been going and kind of talking to these different practice owners. It's funny because you start to see the difference between the private practice, a younger private practice owner versus a younger private practice owner versus an older private practice owner. So the younger private practice owner is kind of more exposed to the DSO model, and they kind of to an extent start to build in that way because they want to start building multi-practices, kind of group practices feel, whereas someone who's been established for 20, 30 years and they've been successful, they're kind of stuck in their way and they're able to do that. So the biggest advice I could say that I've learned through this is, and actually Dr. Lee Gauze, he's the one that gave us this, is start looking to practice the dentistry that you want to do as early as possible. So if it's private practice, if it's high end, if it's if it's very bread and butter dentistry, if it's aesthetic dentistry, whatever it is, try to find that situation first. And I think that's been the biggest priority of mine as I'm going through this job search and this job hunt.
So now we kind of want to talk to you all about how we've been going about, getting our CVs, our resumes out there for these different practices to kind of pick up. So Indeed, I've been using Indeed a lot. LinkedIn has been huge. And kind of like word of mouth, not as much, but definitely a little bit. Just kind of reaching out to people or dentists that I know in the area and just saying, hey, do you know anybody who's looking to hire? Things of that nature. And it's interesting because you think that we would be at a crazy disadvantage because we're new grads. I haven't necessarily seen that yet.
Yeah, I haven't.
Not yet. I'm sure there is some practice owners or certain DSO locations that might not necessarily want new grads, but I just haven't come across that yet. I don't know if
yeah. So I mean, there are definitely locations that people are opening up. Maybe don't want a new grad as a solo doc in certain offices and different things of that nature. But it's not that they don't have an opportunity for you. You want to kind of go where you want to go. It's funny that Tyler actually said that started out with the Indeed and the LinkedIn. I've actually feel like I've gotten more leads or more viable leads from the word of mouth. Being able to talk to someone that their personality, the type of person they are, the type of dentist that they are, or the type of priorities or the mindset they have, and they would be more easily or more better suited to link you with a situation that fits your personality, that fits what you're looking for better than necessarily finding a recruiter. In my mind, just because that's a whole another step of getting to know the recruiter, building that relationship. Then the recruiter puts you in touch with maybe another regional recruiter, or they'll finally put you in touch with the lead dentist, who will then have to put you in touch with the owner. It's like 4 or 5 different relationships that you have to build in order to get to to understand what you're getting out of the contract. So you may get a contract or a proposed contract from a recruiter or from a practice manager, and then you want to talk to the dentist, you want to talk to the past dentists that work there, you want to talk to the practice owner and really get a feel of what that practice is like, so you're not getting into a situation that that seems really sweet, but at the end of the day, and it's not even that it was a bad situation. It's not the situation for you.
Right.
So, and that's one of the biggest things that we always talk about.
Feel the vibes for sure. And
taking that right first step.
Exactly, and it's funny, right? Because if you don't know better, like when you know better, you do better, right? Mm-hmm. So, I was talking to a bunch of different recruiters from practice or owner docs, whatever it may be, and I was like, okay, this feels good. Then I met an owner doc who I really vibed with. And granted, even though the situation might not work out, whatever it may be, like that's the standard now.
Yeah.
And it's like, I'm so glad that I didn't jump at that first opportunity. Because now, when I look back on the previous experiences that I had, their vibe wasn't, what I thought it was, just because I didn't know any better. So keep that in mind. Another little funny thing that I love like telling people, especially people who are considering like building their brands and really doing certain things within the dental field as dental students, whether that be community engagement, whether that be some type of activation for your school, whatever it may be. Literally, I would say honestly, if I probably talked to about 15 docs, and I would honestly say maybe like 13 of those docs have brought up FutureDDS. Granted, I definitely did put it on my resume because, of course, we're proud of everything that we, as well as you all, have built with this community, and everybody talks about it. Yep, so for all of you people who have something going on social media, all you people who are doing things in the community, everybody who is doing something of substance, put that on your resume as well, because at this point, you want to have certain things that help you stand out. Because all dental school students, like, let's be real, like, we're all pretty much on the same level, realistically. And so if you can have something that make you kind of shine a little bit, put a light on that and show them, because that's what's going to help you get that ideal job that you would look for, or that you want to look for, whatever.
Yeah, for sure. Another big take home from this process is, when you talk to these recruiters, you got to understand that at the end of the day, they are recruiters. They're there to make you feel good. They're there to make everything sound like the best situation ever. They're there to make sure that they're filling their quotas, as well as, obviously there are some people out there that build good relationships and they put you into a really good situation. But at the end of the day, sometimes it is just, figuring out what you like. If it's money, we'll throw more money at you. If it's location, we'll try to put you in that location. So it's cool to at least get that exposure to that. But then again, it also can be a very transactional type of relationship to an extent. So keep that in mind when you're going forward. Not every business relationship you have is going to be a friendship. Understand that as well. So like when Tyler says, he had a really good situation where he found a doc where he really connected with, and I've had similar situations like that too. Like, really lean on that. Even if you don't work for them, I'm sure they'll be able to connect you with resources, that they'll be able to connect you with opportunities. God forbid one of their doctors decides to open up a practice, who do you think they're going to call first? You know what I mean? These are the type of things that you guys start thinking about, especially now transitioning from school to the next step and thinking about the following steps after that. Practice ownership, mentorship. Mentorship's a huge thing for me. You know what I mean? Like, mentorship is probably one of the biggest draws for me. It's like, if I could take less money to get a way better mentor that will put me 5 years ahead of schedule, I'm going to take the opportunity before taking an extra $20,000 on a signing bonus or something like that to go somewhere where I'm not sure. I might get good mentorship there too, but I'm not sure. You know what I mean? So that's one of the biggest take homes that I feel like I'm taking away from this as well.
So now, we want to talk about contracts, some of the things that we feel like are very important for you to look into. And honestly, like, there are a bunch of videos on YouTube about this. And our actual practice management course leader, Miss Bellucci, she actually,
Angel. She's
amazing.
She is amazing.
Shout out to her. Shout out to Miss Bellucci for sure. But she's helped us look at a couple of different contracts, whatever it may be. And if you want to go and do this step as far as getting a lawyer to look at it, there's a specific dental contract,
attorneys,
whatever it may be,
CPAs,
that look specifically at dentist contracts. Then do that. But I know, like, one of the thing, of course, compensation. Another thing, like we said earlier, that non-compete is huge, especially if you don't know if you're going to stay with that person. Granted, you might, which is also a great situation where you can buy them out, or within the DSO, you can grow. That would be a great situation as well.
That's type of situation I'm kind of leaning more towards. Fast track into ownership.
It's possible, but you do want to keep in mind, like, that non-compete. What are some other things? Benefits, right? You need health insurance.
Working for DSOs, at times you are in a corporate structure. So if you need to go to a different location, that may be something, if not specified in your contract, that may be something that's asked of you. Maybe not anything you have to necessarily do for sure, but obviously in corporate, if you build those relationships when the opening does open up in the New York or not, maybe not New York, you need a residency, but the Atlanta, the downtown Atlanta, the downtown Houston, the LA, the Washington DC. When these situations open up, they're gonna be looking at you to try to go open up that practice before they look at someone else who isn't necessarily willing to sacrifice because they may have other things on their plate. They may have other priorities that they're working on their own and don't necessarily think that fits into their scope. So, you know, a lot of different things to work out or to think about with that. Again, compensation, sign-in bonus.
Or even if you do decide to leave the job, some jobs, if you don't give them like a long enough, I guess, what is it?
Like you have to give them notice. You have to give them notice.
If you don't give them notice,
a lot of times it's 90 days. It's like 3 months in advance.
And if you don't do that, you owe them money per day, like $8.50. You know, and that can add up very quickly. You know, you want to look into if they're offering like a 401k. You want to look into, and this is actually more so outside of contracts, but even just like patient population, you know, like kind of what Tyrell said, and Dr. Goss, kind of lean into the dentistry that you want to do. Well, you know, if you know that you go to an office and you won't do any type of,
you're not doing any, if you're not going to do implants and veneers,
like that, if that's something that you're interested in, you might want to, you know, keep that in mind. Of course, you might be somebody who's like, hey, I want to get my basics down, the fundamentals. That's great also. But, you know, you might also want to think about going somewhere where you can eventually learn how to place implants, how to do veneers, how to do these extra things that you aspire to do. What else? Another
big thing, and I heard this as a tidbit on not even looking at the contracts again, but choosing the correct job, is sometimes you wanna talk to the specialist that the dentist at that office refer to, because they'll be able to tell you what the work looks like. They'll be able to tell you how many retreat cases and different things of that nature they'll have, because you know.
Because you know the quality of the owner dentist.
Exactly. Anyone can can tell a story and kind of present themselves to the best of their ability, but at the end of the day, the work tells itself. You know, the work can't lie. So just talking to different specialty, even if you're looking for a certain area, specialists are going to know which dentists are, you know, about to retire or looking for a new associate, another associate that's leaving. You know, dentists talk. Once you get into that network, you can kind of start, you know, building your own rapport with these dentists and different things of that nature. So again, it's not always about the numbers. It's not always about, okay, I can make this amount working 4 days a week in this location. Because if you're in the middle of nowhere making $50,000 more, you'll never be able to necessarily build as good of a network in the city that you actually want to move to.
Right.
It will be basically start from scratch again, and you'll have your work to show, which is there's nothing wrong with that. But if that's not what you want, and you know you don't want that, then make sure you're putting yourself in a position to make the play.
So another thing, right? Watch out to see if they pay for the lab fees. Who's paying for lab fees? You might be paying for lab fees.
Come out of production. Before you get paid your production, they might take lab fees out.
Is it production or is it collection?
Credit card fees.
Okay, what about the draw? So there's a certain system, right, where some of these contracts will say, okay, if you don't make a certain amount of money, you owe us.
Yeah.
Which is, as a new dog, you're like, whoa, I don't even, granted, I might have done 15 crown preps, but that's it, you know, like you don't know what you're able to do, you know. I mean, granted, I do believe, honestly,
you can swipe as much as you want, but at the end of the month, you have to be able to pay it.
And it just is what it is, and it's like, of course, I would love to say, you know, if you're a hard worker, you can go and get it, but who knows? Does that practice even have enough patience for you to keep you sustained, to keep you working? You know, these are a lot of different things that you have to really, really dissect and look at the actual practice, look at the owner, look at the contract. And I'm not gonna lie, it is very overwhelming. It's a lot, especially when you're trying to do the licensing exams, trying to finish your requirements. It's a lot going on, but you know, my suggestion is to start early, because I believe the more contracts that you see, the more people you are able to talk to, it'll make it easier for you to decide on what is a good opportunity and what's not a good opportunity, you know?
Yep, definitely start early. Again, write down, make a list of literally the top 5 to 10 things that you want, and then even break that down to the top 3 non-negotiable things. So you got 3 non-negotiables, and then the other 7 are just things that are pluses.
Right.
And you know, if you got all 3 are non-negotiables, and this place has 5 pluses, this place has 7 pluses, go to the place that has 7. You know what I mean? So and then, you know, maybe lastly, just make sure you're finding, even if it's not a mentor doc that you can work with, make sure you're finding someone you can really trust. Again, like we have Mrs. Paolucci, someone that you can trust that will has no skin in the game, so to speak, and that can tell you objectively if you have a good opportunity or a bad opportunity, and then you can make your own decision based off personalities and relationships built. So,
So another thing, make sure the practice philosophy fits who you are as a practicing doc, right? Because your license is your license. If you do something, if you skip a certain corner or
you go in there and do an endo you can't do yet because
whatever, and you lose your license, it's on you.
Yeah.
And okay, I'd much rather take 130, make sure I know what I'm doing for those first couple of years versus me hop in and me have an opportunity where I can make 260. I'm just trying stuff.
Trying everything.
And then what happens? Boom, I lose my license because I was trying to do more than I'm capable of.
Even if you don't lose your license, how many cases are going to have to come back? You have to redo. That's chair time. You're losing money on the back end. So you're going to get that money up front, but now your second year, because half of the crowns that you did are failing, or whatever the case may be, you only making 160. Where you made 260, now you think you made this lifestyle, or you're living this lifestyle, and God forbid you're getting paid off of a draw off the 260 because of what you made last year. Now you got to pay them extra however many $1,000 a month just to make up for that production you don't have anymore. You know what I mean?
On top of that, money aside, these are your patients. This is, granted, dental school and the real world are very different because realistic, let's be real. Dental school, you have the faculty, the supervising faculty to kind of help you out. If they say, hey, stop, you don't want to do that. You want to do this. You might not have that actually, you won't have that in practice because you'll be not by yourself, but the owner doc, whoever is behind you, is not going to be over your shoulder the entire time.
They got their own work.
They got their own stuff. So you want to make sure that you're doing what's best for your patient because, one, why did you get into the profession? To help people. Two, that's your reputation. If you start doing crazy things just because you want to make a lot of money, word travels very fast. And especially if you're somewhere where you want to practice in the future, you can easily isolate yourself by being an aggressive, a non-compliant dentist. So just really think about these things and don't be, we all know that these loans are horrible.
They over our heads, a big cloud.
But don't be consumed in that to a point where you make the wrong decision.
Yep, don't make the wrong decision. Again, just to piggyback off that, every doctor, dentist I've talked to 5-10 years out, they don't remember a test they took. They don't necessarily, they understand that they have the debt, but at the end of the day, now they're comfortable with saying, you know what, it's very manageable. Yeah. Maybe some of them, not all of them have it wiped out, but all of them have a system in place in order to attack it, you know what I mean, and are still living a very comfortable lifestyle, still are building families, still are building more, opening more practices, extending their networks and doing all these other things. So don't necessarily see this debt, as a reason to take opportunity that really is just not for you. Right. That's gonna wrap up the video, guys. If you guys, have any questions for us, if you guys have any tips, any type of advice or things that you've heard about contracts,
let's talk
look,
about
man,
it.
please don't leave us in the dark now. We need this is a two-way street, okay? But yeah, add it down to the comments, send us a DM on Instagram. We can start that conversation and kind of get into it. But if you haven't already, make sure you hit that like button, the subscribe button, and the notification bell so you know whenever we post up new content. And that's gonna be it. See y'all next time.
All right, y'all.
All right, now thank you.